Thank you, Madam Speaker. I have a few comments on Bill C-284. I want to start by acknowledging the sponsor of the bill, Senator Mohammed Iqbal Ravalia, and congratulate the originator of the bill in the House of Commons, the Honourable Judy Sgro, who has put her considerable parliamentary experience towards making this a strong bill. Also, a shout out to the following organizations who represent Canadians who are blind: the Canadian Council of the Blind, the Canadian National Institute of the Blind, Canadian Ophthalmology Society, Fighting Blindness Canada, and One Sight Foundation. Canadians from these organizations have called for and have helped craft Bill C-84. So the full name of the Act, C-84, an Act to establish a national strategy for eye care. As the preamble of this bill notes, millions of Canadians live with eye disease that could lead to vision loss or blindness if not treated. Eye care is a serious issue. It is thought that 8 million Canadians are living with an eye condition that leaves them at a risk of blindness. That is 20% of the population. A report of the Canadian National Institute of the Blind found that the cost of vision loss to Canada is about $30 billion a year. Now, it is estimated that 75% of vision loss is preventable, but Canadians are not getting their eyes tested when they should be. Guidelines suggest we should be having an annual eye test, but where provincial and private insurance coverage exists, this is often only for a test every 2 years. The inevitable consequence is that 1/3 of Canadian adults have not sought vision care because they cannot afford to do so. Prevention is obviously better than cure, and in Canada we are not doing enough on prevention. Access to eye care differs from province to province, but if we accept that this is a problem for all Canadians, and a serious one at that, then developing a national strategy is what is needed. We need to get the provinces and the federal government to work together to work out how to improve our nation's eye health care. That's what this bill is about: cooperation, planning, coordination. I just want to read briefly from the Canadian Council for the Blind, from their website, just a paragraph here. Bill C-284 has come far, but much still needs to be done. The imminent passage of this bill, they are quite optimistic, the imminent passage of this bill promises improved quality of life for many and signifies a commitment to equality and accessibility in eye care. Collaborative efforts with vision organizations underscore the collective call for fairness. In essence, Bill C-284 is not just legislation. Bill C-284 is not just legislation. It is a pivotal step toward a more inclusive and efficient eye care system for all Canadians. Colleagues, that is why I'm supporting Bill C-284, the National Strategy for Eye Care Act. Thank you.